Hello, everyone. We're just waiting for people to get signed in, so we'll be starting in just a minute. So, hello, everyone. I'm Katie Bishop. I'm a Nutrition Policy Associate at the Center for Science in the Public Interest, and I'm going to be your moderator today. A couple of quick housekeeping details. I wanted to let you all know that we will be recording the webinar. And we will also be sending out an email to everybody who registered, so with a link to the webinar. So if you aren't able to stay on for the whole thing, or you know somebody that you want to send it to, you will be getting an email with a link to the webinar and then also a PDF of the slides. If you'll also notice the chat box feature on the side of the webinar, throughout the webinar you can type in any questions that you have, and we'll be gathering those for the Q&A period at the end. Or also, if you have some sort of technical issue, you could write it in there and we will try to help you out. So you are listening to the Journey to Executive Order 1306, How Washington State Adopted a Policy to Improve Food on State Property. And this is part of the ASTHO Food Marketing Workgroup and NPLAN webinar series. Today you'll be hearing from 3 great speakers from Washington State who will share how Executive Order 1306 went from a policy idea to an executive order, and then also how the Department of Health is preparing for implementation. So our 3 speakers today are going to be first Victor Coleman, who earned his Bachelor of Arts from Michigan State University and his JD from the University of San Francisco. He has worked for the public health field for over 30 years, initially in California for nonprofits and multiple levels of government. His focus is in primary prevention and related policy, systems, and regulatory solutions. In Washington State, he was a legislative liaison and policy advisor at the State Department of Health for 8 years, and he is currently the co-principal of Uncommon Solutions Incorporated, a public policy consultant firm based in Olympia, Washington, and serves as the director of the statewide Childhood Obesity Prevention Coalition. Next, you'll be hearing from Colleen Arsenault, who is a healthy eating coordinator for the Washington State Department of Health's Healthy Eating Active Living program. Colleen's roles include working with communities, schools, work sites, and state partners to help make their eating environments healthier through policy and environmental changes. And one of her specific projects is the coordinator of the Department of Health's food procurement work. Finally, you'll be hearing from Katie Meehan, who is a health educator with the Health Promotion and Communication section in the Division of Prevention and Community Health at the Washington State Department of Health. Her work includes providing health promotion and communication support for offices and programs throughout the division. And she graduated from Western Washington University with a Bachelor's of Science in Community Health. And without further ado, we're going to hear from Vic Coleman.
Great. Thank you, Katie. Welcome, everybody. I think I'm going to get control of the slides here in a moment. Oop. All right. So let's start just giving you a little context about who we are. The Childhood Obesity Prevention Coalition, you can see some of the basic facts here about our group. The impetus for the group really came about over 10 years ago when some of us, both inside government and outside, saw this whole tsunami of an obesity epidemic and some initial solutions being thrown around in the state legislature and elsewhere. And it was a pretty shotgun approach that we saw that folks, even nutrition and physical activity, weren't really talking to each other, much less any of the healthy eating people talking to the active living people. So we wanted to create a bigger tent for what's now called Healthy Communities work. So that work began in 2004. We had sort of a precursor group, and really got started in 2007 as a coalition and started advancing policy agendas in 2009. Here's a quick look at our members, and you guys will have access to this PowerPoint. I'll just make a couple quick points here. We have a pretty varied membership. We're 50 now. We have both public and private members. We have both local and state and regional entities included. The membership requirements, basically, we're looking for engagement, and whether that looks like in-kind staff support or engaging in policy advocacy or certainly dollars, that's what we're looking for with our members. I would call out to the American Heart Association on this issue, was a huge partner, and really we worked hand in glove with them from the beginning. So here's the 5-year roadmap that we were on, and we'll go through each of these one by one, but you could see it did actually take us 5 years from initial research to getting something passed this past October, and now we're into implementation. So I guess 4 years to actually get the policy enacted. So one of the takeaways, clearly, policy and systems change really does require patience. So let's go through this multi-year process. We started hearing about this idea. It was an executive order that Governor Deval Patrick actually put out in 2009, I believe, his first State of the State address in Massachusetts. And we were very intrigued by this thought. A lot of us were intrigued with the idea of, what does it mean where, you know, the government is actually has a role in feeding people, and what are the standards, if any, around food and beverages when you go on government lands, government property, etc. And Massachusetts did step out on that. They were pretty slow to implement. We were waiting to hear how that initial work went, but that was very new work back in 2009. So we grabbed a graduate school class at the University of Washington, and Professor Donna Johnson was a real support here. And that class took on this issue as a project, and they really did that front-end policy work, determining what's the current reality and whether or not it leads to some policy solutions. And I guess maybe I should set some clear context here, because we're throwing around different terms like procurement and food and beverage standards. And just to be crystal clear, we're talking about when government is in the business of providing food, whether to its employees, to visitors who come on its property, or to the people it takes care of. And we'll use the term custodial populations. So the government wears different hats in providing food and beverages, and we wanted to cover all of those. We had a big debate about whether we should also go further and cover places where government money is paying for food. And just to be clear, we did not go that far initially with the work you're going to hear described today. That is still work, or at least thinking, that has to get done. And the very tangible example there is if you've got any sort of government money going into, say, an adult family home to pay for food. Maybe adult family homes get some sort of support or subsidy from the state. Because there is state money involved in that case, you could say with that state money you need to comply with certain food and beverage standards. So you can sort of follow the money. Where there's government money, these standards must apply. We did not go that far. So we stayed sort of basically where food and beverages were available on government property or land or facilities. In our initial research, basically the biggest challenge we found was figuring out how much food was actually procured or purchased by state agencies in any given year. We have what's called a food umbrella contract in our state, but state agencies are not bound by that contract. It's a contract they can use, but they don't have to. So back then we were looking at somewhere around $21 million worth of food was purchased off that food umbrella contract. So that's a substantial number. But we didn't know if that was 10% of what the food purchasing by all state agencies was. Was it 50%? Was it 90%? Because we'd have to basically do a survey of every state agency and ask them, hey, when you purchase food, where did you get your food from? And frankly, to this day, we don't have an exact number or percentage of that food umbrella contract, but we believe it's at least a majority of the food purchasing is coming through that food umbrella contract. So in any case, that was a challenge because it's hard to sort of paint the picture of, hey, we've got a problem or we've got solutions if you can't completely describe current reality. So for those of you doing some digging on this work right now, that's some real homework you can get started on immediately if there's any way to get a survey. And we debated about doing that and figuring out how much food purchasing is happening to kind of get a snapshot of current reality. That's work you can get started on now. So after that initial research, we did see that there were varying standards or no standards available that came with food purchasing. And so we decided we needed to write a bill and say, okay, when the state is in the business providing food and beverages, we wanted to at least make sure that the food comes with minimal sets of nutritional standards. And so that's what the initial bill said. And we did get an initial hearing that first year, and we did struggle, frankly, to get out of that box of being seen as sort of a nanny state kind of a bill. We tried hard to create messaging around government efficiency, and I'll say a few words about messaging in a minute. The messaging didn't resonate, especially with the more conservative side of our legislature. We really thought that talking about government efficiency was a good frame, and I still think it is a good frame. It just didn't resonate initially. One of the bigger sticking points, too, at the outset was our Department for Services for the Blind, who have a monopoly contract on concessions in cafes and state buildings, and they were concerned about any shifts in their business practices might reduce profit margins that go to pay for programs for sight-impaired people. So that message came out as well in the initial policy committee hearings. So we got it back to the same committee that following year, did get it out of that initial committee, and then sort of ran out of time to get a fiscal committee hearing. But we have something called fiscal notes that come with bills, and the state agencies were not really bought into this idea yet, and their fiscal note was pretty high, and there were some embedded assumptions in that fiscal note about healthy food costing 25% more, and that drove some pretty high numbers there. So moving on to just last year in 2013, definitely some shifts happened at this point. We had the Department of Health on board. They grabbed this idea of food and beverage standards as a priority in the community transformation grant that they received from CDC. So that became a priority for them, and that was really critical because they were able to be a mouthpiece with other state agencies. And we sat around the table a few times before and during legislative session here in late 2012 or early 2013 and did have policy agreement among all the state agencies. And this was critical because Department for Services for the Blind really had to go along as a state agency, hearing that many other state agencies felt like this was a good idea and it was feasible, and the Department of Corrections was a big player in this. They felt like they were already making changes in their nutrition standards, and they did not have a fiscal note with this bill. So hearing from sister agencies, I think, made it harder for the Services for the Blind agency to kind of be there all by themselves. So that was a critical piece. We still struggled, though, with the messaging. It still was a partisan bill, and we knew that we had to figure out a different way to message or a different way to take a policy approach here. And as Colleen Arsenault will describe in just a few minutes, there was already a work group underway via the State Department of Health. So there was a couple of swirls of activity around this work at this point. So prior to actually getting it into an executive order, I do want to describe a little bit about the message framing here, because we did run this idea initially about government efficiency. And like I said, even though I and others thought it was a good message to frame around, it didn't take root. When we went back with our next iteration of the bill, House Bill 1321, we then focused on the government as model. I would say something like this in testimony. Look, the government is spending a lot of money telling its citizens how to eat better and move more, but when you come onto government facilities or government property, it's hard to find the healthy choices, whether that's a vending machine or a cafeteria or a cafe. And isn't that hypocritical that the government cannot provide healthy choices when they're trying to preach that we're supposed to make healthy choices as citizens? That seemed to resonate a little bit more, but as I said, it still didn't quite get to a bipartisan support at that point. But that led us into our new governor, Jay Inslee, who talked on his campaign about childhood obesity as a big issue and was very interested in ideas, and his policy staff was apprised of this bill, and they really started to think about, why can't we convert this to an executive order? This is a bill that really only applies to state agencies, and at least in our state, an executive order is something where the governor can tell state agencies what to do. They have jurisdiction with an executive order to direct state agencies. So this bill felt like it was easily converted to the idea of an executive order. So with that executive order, we started kind of small with basically this bill frame, but then it grew out into a much broader worksite wellness frame and grabbed other concepts and ideas. And so ultimately, the message framing we got to was, it got wrapped up into worksite wellness, which I think is a strong message frame. But I'll leave you with this question. Is it a good idea to run this idea as a standalone? Are food and beverage standards / procurement a good standalone policy idea to push from a winnability, feasibility standpoint? So maybe we'll have some conversation about that, because we'll have a little bit of time for Q&A. I'm trying to advance the slide here. I don't know if I have control over the slides at this point. I wanted to go to the next slide. Maybe somebody can help me with that.
Hi, Vic, are you still there?
I am. Can you hear me?
Yes.
Can you advance the slide? Because I don't seem to have control at this point.
Anna, can you advance the slide?
Thank you. So just my last point here is, we did get the governor to sign this executive order. You can Google it. It'll come up, just, if you Googled with the words you see here, to see all the text, and it's a pretty complete worksite wellness executive order, but embedded within that are basically the concepts we had in our bills around food and beverage standards. What's interesting, these are actual headlines of different media pieces. One was one that we put in, the first one, ensuring healthy food access. And then from a more external media standpoint, you can see back to this government efficiency message is how this Grace Gunther framed the work, streamlining approaches. So as you can see, the message framing here is still, I think, pretty young in its work, and I'd encourage you to, if you're going to undertake this work, to think pretty thoroughly and strategically about what message framing you think might work wherever you are. So that's the front end of this story, is to hear about how we took it from a nugget of an idea to an actual policy enactment that happened just a few months ago. I'm going to pass it over to Colleen Arsenault, and Colleen will describe, sort of picking up some of the early implementation or early thinking work that happened that is now leading into full implementation. So Colleen, over to you.
Hi everyone, I think it might be just a second for Colleen to get back on the phone. Those of us who had called in were accidentally kicked off temporarily. But everybody who was on their computer looks like they stayed on. So
hi, this is Colleen. Can you all hear me now?
yes, Colleen, we can hear you.
I apologize for the technical difficulties. I'll try and move quickly through this. Okay. Thank you, guys. So this is Colleen Arsenault, and I'm a Healthy Eating Coordinator here at the Washington State Department of Health. And I'm going to take a few steps back here and really walk you guys through the development and writing of the executive order. Our leadership was involved in the writing of this, and so I'm going to give you guys a few of the tips and our lessons learned from this. The executive order does address comprehensive worksite wellness programs in state agencies, so some of these tips are not specifically related to nutrition guidelines, but are important considerations. I'll go through the scope of the executive order, and Vic kind of covered this before me, and some of the practical aspects of implementing this within state government. The early conversations of the executive order were that this would cover all Washingtonians, but after many conversations, the scope was reduced to focus on state employees and its custodial populations. Early in the writing of the executive order, we realized that it was very important to engage other state agencies in the executive order development process, especially those that would have large financial impacts, mainly those, again, with custodial populations. There were also unique employee issues that we had to start thinking about and will continue thinking about as well. There are employees that don't have set work sites and those that travel the majority of the time. How will we provide similar supports to those employees that aren't sedentary as to those that are? The rights and the expectations of custodial populations were considered in this process as well. We learned how the agencies interact with their custodial populations, which was very important prep work for the writing of the executive order. It was important for us to set the tone of being practical. This executive order is a starting point for implementing nutrition guidelines in our state agencies, and we felt that being practical was important, especially when garnering support from these other agencies. Finally, the governor is also very interested in this work being measurable, including showing a return on investment. This work will be tied into our overall state performance measurement plan. Continuing with the tone of being practical, providing more healthy options rather than taking away options was an important frame for support for our agencies with custodial populations and with our union partners. We emphasize the importance of purchasing Washington-grown products, but we recognize the practicality of this and that our budgets need to remain balanced. The importance of leadership modeling the desired behaviors and setting the expectation rather than just having a directive. We will emphasize the importance of marketing and nudging individuals towards healthier choices, again, rather than just creating a directive. Engagement at all levels and state agencies was key in this process. Staff from many agencies were members of our food procurement work group, but in many cases the agency leadership and budget offices weren't engaged, so our leadership had to backtrack to get them involved. It is crucial to involve leadership from the beginning. As I mentioned earlier, we have diverse work sites and unique situations for employees, such as those who move around from work site to work site. How do we provide options for all employees? This is something we're continuing to work on. And here are some of our next steps. In a minute, I'll backtrack and go through more information about our food procurement work group. But the next steps of our work include preparing for the implementation of the executive order, which begins this year. The EO formed a state employee health and wellness steering committee, and we will work with that committee to coordinate communications related to the nutrition part of the executive order. This steering committee is chaired by the Secretary of the Department of Health here and by the Director of our Healthcare Authority, where our statewide Public Employee Benefits Board is housed, as well as our statewide Washington Wellness Worksite Initiative. By March 1st, the Department of Health, which is at the end of this week, will provide an implementation guide. We are working hard these days to have it ready by that time. In addition to sending out the implementation guide through the steering committee, we plan on targeting much of our technical assistance to agency wellness coordinators. By July 1st, 2014, all agencies must adopt a food and beverage service policy for employees. Our implementation guide will have a sample policy to assist agencies in this policy development. Agencies will have until December 2016 to fully implement the guidelines. For many agencies, it won't take this long, but for larger agencies with offices in every county and many small institutions, such as the Department of Social and Health Services, we feel this time frame will allow them to achieve the goal. And finally, we're gearing up to adopt and implement the guidelines here at the Department of Health. Our goal is to be the first or one of the first agencies to do so. Our Health and Wellness Work Group will review the policy within the next couple of weeks, and we hope to have it adopted by the end of March. All right. You heard from Vic before me, and he echoed this, and I think it's important again to stress the importance of the public-private partnership that helped us to get to where we are today. The Childhood Obesity Prevention Coalition, along with the American Heart Association, really helped to jumpstart the issue and create legitimacy for it as an idea here in Washington. Because of their work, this work was then prioritized within the State Department of Health, and we were able to secure community transformation grant funding to support a position dedicated to food procurement. With dedicated staff, the Department of Health was able to convene a food procurement work group made up of representatives from both the public and private sectors. This work group had been meeting for over a year when the executive order was signed. The food procurement work group was made up of representatives from multiple state agencies. In addition to those you see here, we also had representatives from the Department of Social and Health Services, the Department of Agriculture, the Department of Enterprise Services, that's who houses our food umbrella contract that Vic mentioned, the Department of Agriculture, sorry, I just said them, and the Office of the Superintendent of Public Instruction. In addition, Healthcare Authority, who is our co-chair of the statewide steering committee, and additional representatives from local health jurisdictions in Clark, Thurston, and Pierce counties were also members. Work group members developed the state's healthy nutrition guidelines and informed the development and content of an implementation guide. Their participation assisted their agencies and organizations in understanding and gaining support for this work. Though, as I mentioned earlier, the work group representatives were not always able to communicate this work up to their leadership and budget offices. This is definitely one of our lessons learned from the work group. The work group's main goal, as I just mentioned, was to develop nutrition guidelines for all foods served or offered in state agencies, including vending, cafeterias or cafes or on-site retail venues, meetings and events, and institutional food service. There are many great examples of other guidelines that already existed, and while we did not want to recreate the wheel, in some instances we felt that we needed to adapt guidelines to meet our specific needs. One example of why we felt we needed to adapt guidelines is that most of the cafeterias located in our state agencies are run by small businesses, and the majority of these business owners are blind operators trained through our state's Business Enterprise Program. These cafeteria owner-operators do not always have the resources to do nutritional analyses of their menus. making nutrient-based guidelines difficult for them to follow. For this reason, early on we decided that our cafeteria and institutional guidelines should be food-based rather than nutrient-based. We did have a formal process for developing guidelines, as you can see here. We reviewed other guidelines, identified those that would work best in our environment, narrowed those down to one set of guidelines, which served as a starting point for ours. This process was slow and took us 1 year and 5 months to complete. Now I'll go through some of the challenges we faced while developing the guidelines. As I previously mentioned, we engaged our Department of Services for the Blind from the beginning of this work. Based on much of the groundwork by Vic and others, we knew that DSB would be a critical partner for us. The manager of the Business Enterprise Program, who also happens to be a registered dietitian, regularly attended our meetings. She was a vocal member and was very good at reminding us to keep the bottom line in mind. The cafeteria owner-operators are small businesses, and a negative change in revenue could be devastating to them. In the end, we did manage to come up with a set of guidelines with which we were all happy. Or maybe I should say that we were happy and DSB was satisfied. It took us a while to decide on the format for our cafeteria guidelines. I mentioned earlier that we wanted to keep practicality in mind and to steer away from a directive, especially with cafeteria guidelines. We wanted to promote the idea of choice, not only for the consumer, but also for the cafeteria operators. That's when someone shared the RAND performance standards for restaurants with us, and we thought this would be a perfect way of improving access to healthy choices while not being too prescriptive. For those of you who are not familiar with these standards, they're essentially a menu of options from which restaurants can choose while striving to meet a set number of points. We did adapt these to fit our cafeteria setting rather than a restaurant setting. Other areas where we spent a bit of time were deciding how we would define low-calorie beverages and choosing what our sodium guidelines would be. Should we go with low sodium or use a similar approach as the GSA guidelines and start with lower sodium and slowly reduce sodium as the consumer's palate adjusted to the difference? We ended up choosing the latter, and our sodium guidelines align very closely with the federal guidelines. And finally, it was difficult to maintain focus on developing the guidelines and not jumping into how these would be operationalized. I believe that part of the reason for this is because we did have such a diverse group of stakeholders at the table, and this is how the idea of the implementation guide began. My goal was to keep the nutrition guidelines very focused on nutrition and, as I would say, clean, but we kept running into questions of how the guidelines would be operationalized and how we would provide the implementers with technical assistance. The implementation guide was an answer, as Vic once called it. It was a safety valve to many of the issues raised. We would just put them in the parking lot and address them later. Ideas that were brought up, but not specific to the guidelines, were placed there. We identified this need before the executive order was in development, which is why the implementation guide was included as one of our deliverables through the executive order. It is a way for us to provide all of the 39 impacted state agencies with a resource for implementation. While we do plan on providing technical assistance to agencies as they adopt and implement the guidelines, we currently don't have the capacity to provide all 39 agencies with individualized technical assistance. To develop the guide, I reached out to our health promotion staff for assistance. Katie will now walk you through the process she led in developing the content of the implementation guide.
Great, thank you, Colleen. As Colleen said, we're going to do a walkthrough of our process for developing the implementation guide. Our first step to developing the guide was to define and assess our target audiences. So for this implementation guide, there are really 3 audiences. There are the adopters, the implementers, and the consumers. The adopters for all the guidelines are the agency leaders. The implementers depend on the guideline area. They include the food service managers, the cafeteria operators, the vending operators, event planners, and meeting coordinators. The consumers are the employees and custodial populations that will be affected by the guidelines. So all 3 of these audiences have different needs in terms of implementation resources. And by assessing them separately, it allowed us to make sure that our end product, the implementation guide, would meet all of their needs. So for all three audiences, I'm going to take you quickly through our methodology and just share a few of our key results. We'll start with the adopters. To assess the adopters, we conducted key informant interviews and facilitated a discussion with agency leaders. We wanted to learn three main things. What are their agencies already doing around worksite wellness? What barriers they anticipate to adopting a healthy food and beverage service policy? And what would motivate them to adopt and implement the healthy nutrition guidelines? I'm going to go through 4 findings to share with you. Our first finding was that all agencies are doing something to promote health and wellness, from wellness programs, healthy vending options using FitPick. Some cafeterias were planning their menus based off of the Heart Healthy diet. It was important for us to know that worksite wellness policies and programs were not new, and that all the leaders that we talked to were already engaged in promoting health and wellness in their workplace. Our second finding was that the agency process for adopting new policies differ. To implement the healthy nutrition guidelines, agencies would first adopt a healthy food and beverage service policy. So from this, we learned that the process for creating, adopting, implementing, and communicating about new policies differs from agency to agency. Our third finding was around barriers agencies anticipated facing. Leaders were concerned about the amount of resources, especially in terms of staff time, that it would take to implement the guidelines. They also anticipated resistance from employees. They were afraid of alienating employees or to make them feel like the agency was taking away their choices. They were also concerned about how the guidelines would affect the bottom line of cafeterias, Colleen mentioned a bit earlier. And even though agency leaders anticipated some barriers to adopting and implementing the guidelines, overall they were pretty motivated to participate. There were a few things that they mentioned that would make them even more motivated or comfortable. Those include having labor on board. They also wanted to see that the process was collaborative. They wanted to make sure that the guidelines were evidence-based. They were interested in having messaging be more value-based and make sure that it highlights choice. And they also expressed the need for support from the Department of Health for adopting the policy and implementing the guidelines. And they also asked for some form of recognition they could get from the Department of Health for being an agency that fully complied. So from these results, we learned a bit about what we would need to include in the implementation guide for adopters. This included information about who the executive order would affect. They wanted to know about the long-term outcomes of implementing the guidelines, what effect will it have on the health of their employees and the populations they serve, what will be their return on investment. They also wanted to hear about the success that other agencies had had in implementing similar guidelines. They asked for a model policy that they could easily adapt to their agency needs and adopt. And they also had some questions about how and if they can influence their contracts with vendors. So one of the things that will be included in the guide is language they can insert into those contracts. Because they were worried about staff time, and they knew that this would be something that they needed to communicate about to their employees and promote in their workplace, they asked for prepackaged communication and marketing material that would make it easier for one person, whether that be a wellness coordinator, to pick up and run with. All right, now let's move on to the implementer level assessment. So these are the people that will actually be implementing the guidelines. Again, the cafeteria managers, menu planners, vending operators, wellness coordinators. And the purpose of the implementer assessment was to get their feedback on the feasibility of implementing the guidelines and to learn about what types of resources they would need to successfully implement them. So for our methodology for implementers included a focus group with representatives of the vending industry. We also did interviews with implementers across all the guideline areas. So I'm going to walk you through 4 of our key findings. So the first one is that implementers noticed already a trend towards healthier choices. There are cafeterias that have responded to their customers' demands to provide healthier options. So they actually found that they scored really well compared to the guidelines we were proposing. Representatives from the vending industry said that they're observing a trend towards healthy vending in the Pacific Northwest. The beverage industry sees a national trend. Along the same lines, they're seeing a decrease in sales of sugar-sweetened beverages. And they all said that basically this trend towards healthier choices is also improving product availability. The second finding is around the anticipated barriers or perceived barriers to successful implementation. So implementers are worried about profitability, whether or not their customers would end up buying the healthier options. Even though they see that there are more products available now, there was some concern too about product availability, especially in terms of sodium guidelines, whether or not the products would be there to meet strict sodium guidelines. There's also some perceptions that customers don't make healthy choices when they're hungry and that healthy eaters tend to bring their own food to work. And also a belief that, for example, for vending, that people go to the vending machine when they're looking for pleasure food and not necessarily a healthy snack. For our third finding, basically when we look at the barriers, what comes out of it is that promotion and marketing are essential. Overall, the implementers see the possibility with the guidelines, and all the food service venues, cafeterias, cafes, vending machines, see that by increasing healthy options, there's also a potential to reach a new customer base. Implementers who have been involved in similar efforts found that engaging consumers in the process is really important, and we're going to include tips for that in the implementation guide. For example, there were some work sites that invited customers to be part of an item selection process to choose what goes into vending machines. Others organized taste testings or surveyed their employees to see what healthy options they'd like in cafeterias. Overall, though, the implementers expressed a need for support from their work site to communicate about and promote healthy options. And our fourth finding, in reviewing the guidelines, implementers found them feasible to implement. Kind of as Colleen talked about the timeline, they really appreciated the flexible timeline for implementation because it will take some time depending on the food service venue or, the cafe. Also, vending operators mentioned that it will take them about 6 months to switch over a machine and to really build a menu that reflects the needs of the building that it serves. And as part of their switch over, they'll need to retrain their drivers as well. So from our results, we learned a bit more about what implementers would need in the implementation guide. They also asked for prepackaged marketing materials that would help them label and promote the healthy choice, planograms and product lists for vending operators so they would know what products meet the guidelines and how they can organize their machines so that products sell better. Example meals and menus for cafeterias. Both cafeterias and institutions wanted an easy-to-follow implementation checklist to help them know where to start when they're looking at the guidelines. Where do they start implementing? Also consistent with agency leaders, they're interested in hearing about other success. What other cafeterias have been successful in implementing similar efforts? Was also really important that we learned is that implementers wanted the ability to apply for recognition separate from the agency. So not all implementers have close relationships with their leadership, but a lot of the responsibility of implementing, operationalizing, and adhering to the guidelines really lies on them. So having a separate vendor application for recognition would allow them to get that recognition for that effort that they make. All right, so now let's move on to our last audience, the consumers. So these are the people that will be affected by the guidelines in terms of food and beverages. So the employees and custodial populations. Based off of the results of the adopter and implementer assessments, we had planned to develop materials to market and promote healthy choices that meet the guidelines. And we wanted consumer feedback on the appeal of different messages and images that we would use. So we ended up doing an online survey that we sent over 7,000 state employees, and I'm going to just pull out 3 of our key results to share with you. The first one is that employees do want access to healthier food choices. So in the survey, we asked about how important it is to have healthy choices available at work, and the majority of survey participants found this important or very important. We also asked about how often people use the vending machine or go to the cafeteria, and whether or not healthy choices would increase their use of cafeterias and vending, and in both cases it would. So there's really only a small percentage that said that having healthier options would decrease their use. So by increasing healthy options, we should actually see a growth in customer base, not a decrease. The second finding we saw was that nutrition information does influence decisions. So about a half of the survey participants said that nutrition information does influence their decisions on what to buy, to eat and drink, but not all of these people always look at that information. We also heard that people prefer to get information about the positive benefits of healthy eating than receiving information about the negative consequences of choosing the unhealthy option or getting no information at all. So this will help us in our future development of marketing materials to make sure that our messaging is positive and also includes health benefits. And our third finding is that messaging should highlight choice. So these are the 5 kind of key or tagline messages that we tested. Overall, people preferred the first one, your health, your food, your choice. And you'll notice that there's actually a pretty large gap between that first option and second runner-up at 27%. So the first one really highlights our values of liberty and choice, which is consistent with what we heard from other audiences about needing to highlight that throughout our implementation materials. We had the same result in our questions about campaign names. Choose Well was one of the names that tested the best. And the most suggested campaign name was actually connecting our choices to how we live. And that's how we ended up with Choose Well, Live Well. And you can see actually our graphic identity campaign name and tagline has been at the bottom of the PowerPoint template throughout this presentation. So these are the graphics and messages that we'll use to create our marketing materials. So this concludes the audience assessment results. Our project website will be live on March 4th, and that's where we will have the implementation guide available. It will be in both HTML and PDF formats for download. And then between now and July 1st, we're going to continue to add resources to the website to aid in implementation, including prepackaged marketing and communication materials.
Great. Well, thank you to all of our great speakers from Washington. Very briefly, we're going to move into question and answer period. But first, I just wanted to mention a couple of other things, and then also just remind people that during the Q&A period, you can type questions into the chat box, and we'll try to get to as many of them as we can. So I'd like to just briefly mention that the Center for Science in the Public Interest provides support and technical assistance to states, localities, hospitals, and other large institutions that would like to work on these types of policies. And we do have a variety of materials on our website that people can access to help them in this work, including model policies and standards, fact sheets such as tips for successful implementation, and a financial impact fact sheet on healthy vending. And then we also have previous webinars up there, toolkits, and some promotional posters that can be used on vending machines or in concession stands or cafeterias that have healthier options. So if you do have any questions on this topic, or your state, locality, or institution is interested in working in this policy area, you can feel free to reach out to me. If you have specific questions that aren't addressed during this presentation, I'm sure our speakers would also be happy with you reaching out to them. So moving into the question and answer period, we've had some really great questions so far, and again, just keep typing them into the chat box and we'll try to get to as many as we can. One of the questions that we received was on the online survey that you sent out to customers, and they asked, what was the response rate, and do you know if that's representative of the total population that you're hoping to reach?
Hi, this is Katie. I'll take that question. We can't actually calculate the response rate because it ended up going out to, basically we sent it through another state agency's contacts with wellness coordinators. So it went out to every state agency or higher ed that had a wellness coordinator at it. So I think we could estimate the number of state employees that are in Washington State.
But then we don't know how many of them actually were able to send it out to their agency. So unfortunately, we can't answer that question. But we felt that when we did send it out, we initially had hoped we could have, 400 or 500 responses to a survey. So when we saw that we had 7,000 responses, we felt that that was obviously a much larger sample than we had initially set out to get. So we're hoping that, and do feel that it is representative.
Great. And another question, what are some similar efforts in states and localities that you learned from while planning these programs?
Public Health Seattle-King County, they, if you look at our vending guidelines, they are actually, the guidelines that we adopted are from Seattle-King County. So they were a member of our work group, and their registered dietitian was, integral into everything we did while planning this. And once you see our implementation guide, most of the tools for vending did come from them because they had done such a great and thorough job on that. In addition, we looked at Massachusetts, we looked at New York City. As far as guideline development, a lot of different municipalities and counties in California had done work, so we looked at that work. We used our own Energizer meetings that we had developed about 5 years ago. And now really we're also looking at Los Angeles County, who's doing a lot of this work, and as far as kind of looking into contracts and how that can be affected. So, and then of course we spent a lot of time talking to CDC and talking with them about their federal GSA guidelines and how they implemented those.
And another question, do executive orders in Washington State have the same effect as a law passed by the legislature?
Hey, this is Vic. I can grab that. Yes and no. The point of an executive order is it can really only reach what the governor has jurisdiction over. So for those that he does have jurisdiction over, meaning state agencies, it does have the same impact as a policy passed through the legislature. However, the next governor could rescind that executive order, so it's got a little bit of tenuousness in terms of its longevity. As long as the next governor doesn't take it away, it's there on the books. But again, it's only applicable to state agencies.
And another question is, so will this be targeting inmates in correctional facilities?
Yes, this will be. We've been working very closely with our Department of Corrections, and they had been working, as Vic mentioned in his presentation, they had been working on improving the nutritional quality of their meals for some time, but these guidelines will impact them as well. And also it will impact individuals that are under custody of our Department of Social and Health Services. So those are some of the group homes or homes with individuals, for individuals with developmental disabilities, and our mental health hospitals in the state as well.
Another question that we received is, what do you mean by developing the nutrition standards to be food-based versus nutrient-based? Could you just provide an explanation of what that means?
Yes, I can. So for those that are familiar with other guidelines that are out there, the federal GSA health and sustainability guidelines are nutrient-based. So that's really where it goes into specific nutrient amounts, specific calories that each meal or entree or side dish, specific sodium limits. So that's where you see a lot of numbers, and you need some type of software program, registered dietitian, others to assist you in kind of calculating those numbers. So for food-based, we really went with reading through. I mean, we've read through the dietary guidelines many, many times, and instead of giving a calorie limit, we just tried to focus on increasing the amount of fresh fruits and vegetables, sometimes frozen fruits and vegetables that are offered. So our institutional food service guidelines say a minimum of 2 cups of a variety of vegetables must be offered daily, a minimum of 2.5 cups of fruits, and this one's fruits, should be offered daily. Approximately 6 ounces of grains should be offered daily. So those are examples of specific measurements rather than kind of the nutrient equivalent.
And are you going to do any activities to try to get people to choose the healthier options over the less healthy options that are available in these facilities?
Yes, we are. We had another one of our food group, procurement work group members. She's our resident expert, or my resident expert, in behavioral economics and choice architecture. So she took a bit of time reading through the literature and developing a list of suggestions that cafeterias and institutions, not so much, but also meetings and events and the vending machines can use to kind of place healthier items more prominently, to price them more competitively, to promote them more than we would promote our less healthy options. So we will be doing a bit of work of that. We'll have got like a sheet of paper in our guidelines, but then we'll also do a training probably this coming fall with that work as well.
And will the executive order also apply to foods that come in for meetings from outside vendors? And if so, how will that be monitored?
Yes, it will be for all, most of our foods, at least here at the Department of Health, we don't have anyone that caters in-house, so our foods do come in from outside. So the monitoring is still a question that we're going to be working with the steering committee for the executive order on. But in the past, we've provided training to the meeting and event planners here on the guidelines, how to work with the caterers on ensuring that the foods meet the guidelines, and also providing caterers, working with them to have a list of foods that will meet the guidelines. So I think we'll continue with the successful work that we did in the past with that. But again, the monitoring is still in question.
This is Vic. Quick PS on that. So clearly, when people bring their own food, have an informal potluck, in the employment setting, these guidelines don't apply there. But the norms change that happens in this kind of work does spill down to that, and I'm not sure we'll be able to capture changes there. But I've worked in worksite wellness settings and saw that when you talk healthy food, it does actually spill down and trickle into the personal choices and the informal potlucks, etc.
So it looks like we have time for one last question. We had a couple of questions asking if there is an evaluation plan or looking at estimating return on investment.
We're still in the process of kind of figuring out what our exact evaluation for this will look like. The University of Washington has applied for funding to evaluate this, but we are still waiting to hear if they'll receive that funding. If they do receive that funding, that will be a pretty robust evaluation that should be able to look at kind of all aspects of the evaluation, even looking down at the individual level, as well as how it impacts individuals' choices for food kind of in the long term. Right now, without that funding, we can't do that. So we've tried to build in as many ways to collect information from the agencies as possible. So that is still to be determined.
Well, it is 4 o'clock now on the East Coast. So thank you to all 3 of our speakers. For people who have additional questions, feel free to reach out to me and I can field it to our speakers. There are a few of you who have unanswered questions in the chat box, and I will try to get you answers to those. So thank you, everyone, for being involved and for listening today.